Welcome to the HCMA's legislative briefing for the state of Florida. We will begin our presentation in approximately 2 minutes. Thank you so much for joining us, and we'll just have some fun banter with Dr. Marcos Hasday, who's with Advent Health, the director of their HCM program, and we will be having him present a little bit of information on HCM a little bit later. Good morning, Marcos, and happy HCM Awareness Day to you.
Yeah, good morning, Lisa. By 3 minutes, good morning. Happy HCM Day, Awareness Day to you as well.
Thanks so much. This is the culmination of a year of legislative activity to kind of start the ball rolling on specific states. And we're really excited to be talking to Florida today. And for those of the state legislative body who cannot join us live, we will be emailing this presentation off to all of them so that they can watch it at their convenience. And if anybody has any questions and are not able to join us live, please contact the office and we will be more than happy to assist you. Later in the presentation, you'll see a QR code for setting an appointment, or you can just email us at support@4hcm.org or to my email directly at lisa@4hcm.org. Okay, and we've got another minute and a half or so to go. It's a rainy day here in New Jersey. What's the weather in Florida today?
It's beautiful, but warm. It's going to be warmer than it has been the previous week. We were having high 60s during the day, high 40s in the morning when we were get out of the house in the morning. But then beautiful, clear skies. But today is going to be warm, 84 degrees.
Wow. Might hit 67 degrees today in New Jersey. So it'll be warm today and then it'll be really cold tomorrow. You definitely got the weather on us in Florida. That's for sure. Florida weather's better than Jersey weather most of the time.
Well, I had my two granddaughters last week. I was off and we went to the animal kingdom. And my 5 years old told her mother, I really don't want to go back home because she has such a good time. The weather was so nice and she likes the water so much. Of course, the pool was heated and the weather was pleasant. It was good vacation.
Well, I'm glad that your family got to spend some time with you down in Florida. That's awesome. Okay, we're going to get started here in just a couple seconds. So thank you all for joining us for HCM Awareness Day and the HCMA's legislative briefing. Over the next few minutes, we're going to talk to you a little bit about who the HCMA is, as well as what HCM is. And we're going to hear from one of our physician partners who happens to be located in Florida. So welcome everybody to HCM Awareness Day. So today we're going to cover who we are as an organization, what HCM is. We're going to take a look at your state report card. Did you know you had one? You do. We're going to talk about two stories of patients with HCM who are our cautionary tales. And we have some legislative action that we're hoping the state of Florida takes up to help protect families with genetic heart disease. So we will start with explaining who we are. We are a 501c3 nonprofit organization. We are based in New Jersey, although we have our advocates and our partners worldwide at this time. So we started this organization because of a personal loss. I lost my sister in 1995, and that loss catapulted me to action. I had lost many family members to hypertrophic cardiomyopathy over 2 or 3 generations. So it is our goal to provide support, education, and advocacy to patients, families, medical providers, as well as the lay public about what HCM is and how you can get care for your HCM. And our goal is simply to keep families whole for as long as possible. So one of the programs that we developed at the HCMA was the creation of HCMA Recognized Center of Excellence programs And I'm very pleased to say we have two wonderful partners in Florida at this time. A few others are under development, but the longest term partners we have are Advent Health and Dr. Marcos Hasday, who will be presenting to you in just a few moments on what HCM is. And our other partner in Florida is in Weston, the Cleveland Clinic, and Dr. Craig Asher and his team. So without further ado, good morning, Marcos. Welcome, and thank you for sharing some time with us today. And can you please help explain what HCM is to our listeners?
So, good afternoon, Lisa. It's my pleasure. Um, eh, ACM, or hypertrophic cardiomyopathy, is the accepted term to this condition, which is the most common congenital heart disorder. It is a unusually thickened heart in the absence of other conditions that can cause a thickened heart, such as high blood pressure or a very narrow aortic valve, which we call aortic stenosis. Is often genetic and can be seen in families. The incidence of this condition has been revised with better diagnostic testing and the ability to do a genetic cascade testing on families affected with an individual affected with these conditions. Now we have uh, revised the incidence from 1 in 500 patients to perhaps as frequent as 1 in 200, 1 in 250. So we see them a lot in the clinic, and we are only really seeing the tip of the iceberg because so many patients remains undiagnosed. Hypertrophic cardiomyopathy is the accepted term. The term has evolved from the time that it was first described, in which we didn't know what was it. We used to call it idiopathic hypertrophic subaortic stenosis. So now the accepted term is hypertrophic cardiomyopathy.
Okay. So, can we discuss a little bit about the undiagnosed population and why this is problematic?
Yes, the reason is problematic and can be easily missed is that the symptoms that hypertrophic cardiomyopathy patients have are non-specific. They can be found in many other conditions, and um, lightheadedness or shortness of breath, chest pain, and palpitations. They're so many times frequently found in other conditions. And in addition, this diagnosis requires testing. So if the patient doesn't come to a physician that detects an abnormality on the electrocardiogram or on the physical exam, it will not be directed to a center that can offer the proper diagnosis. So awareness in the community is very important to the medical community as well, and when to refer to a cardiology specialist that specializes in hypertrophic cardiomyopathy. It's important to see it on a clinic that see a lot of these patients because that's how the outcome is going to be to the patient. It depends on the level of expertise. It's very capricious disease, even within the same family. And some members may have a severe obstruction. I have families in my practice that only one person has required a heart transplant and everybody else has been doing well. In that same families, we do have patients that we know have the genetic abnormality and have not expressed the disorder that we can detect on an echocardiogram or a cardiac MR.
So, can you discuss with us some of the treatment pathways HCM patients may experience?
Okay, so I'm going to quote Dr. Maron, which I recognize this slide when he published in the Journal of the American College of Cardiology. Well, Dr. Maron will tell you that with contemporary management, and people can have normal longevity, but the contemporary management requires a level of expertise. There are profiles that are important to recognize in a patient with hypertrophic cardiomyopathy. Again, quoting Dr. Maron, the most visible one is sudden death, but it's not the most frequent one. But it's the most visible one because it often occurs in perhaps in a sports competition. Um, and so it makes the news. It's tragic and it gets discussed for a day or two and then it goes away. but in reality, sudden cardiac death is not the most frequent manifestation of this disorder. And again, quoting Dr. Maron one more time, sudden cardiac death may be just as frequent on the kid that's playing on the school band or in the chess club or in the lacrosse team. It doesn't have to be an extraordinary athlete to be at risk. Actually, in any high school, in any junior high school, one of 200, whether they are good ball players or not, will have this condition and will be at risk. So the importance of identifying everybody is very high. The next point I want to make is that patients with hypertrophic cardiomyopathy often have symptoms because of shortness of breath. This is usually, as you all know, the heart has four chambers. Two of them are pumping chambers. Of great importance in this condition is the left ventricle and the inability to eject the blood or the inability to fill the heart can cause the symptoms of congestive heart failure, and it requires expertise on how to manage this type of condition. When they have obstruction, traditionally the treatment has been borrowing medications from other conditions and see if they work for hypertrophic cardiomyopathy. For the last 2 years, we have had the benefit of having a medication that is really, really designed for the biochemical or molecular abnormality. I don't want to go too heavy on the chemistry of this, but this disorder can now be treated at the level of the heart with very few systemic side effects, if any. So this medication has been a great addition. I always tread lightly when there is a new medication, but I have to say that I have a cohort now, maybe 26 to 36 patients are doing very well. And the great majority of these patients that are on this new medication called mavacamten will have met the criteria to have a surgical procedure to relieve the obstruction. And I haven't had to refer a patient for a septal myectomy in the last 2 years unless they also had a very severe associated abnormality in one of the heart valves. So this type of medications called myosin inhibitors do work. Um, I haven't seen the most severe side effect that has been reported in the medical literature. I'm sure as my number of cases increase, somebody will have the bad luck of having that adverse effect, which is reversible. So I'm very, very happy. My patients are more happy than I am. I try to stay as objective as I can, and they tell me the improvement that they're doing. They're playing double tennis, pickleball, whatever, and they're very pleased with the results of the pharmacological intervention. And the last problem, which is a headache for the clinician and a great concern for the patient, is when they develop atrial fibrillation. Because atrial fibrillation, although it's an arrhythmia that comes from the top chamber of the heart and it will imply that it's perhaps benign, it's not so benign because, first of all, patients with hypertrophic cardiomyopathy tolerate atrial fibrillation very poorly. They really need to have their heart in a very synchronized rhythm. And atrial fibrillation causes an elevated heart rate. The heart is dancing all over the place, and he doesn't like that. And the greatest risk with atrial fibrillation, in addition that it can precipitate congestive heart failure in some of my patients, is that it can cause a stroke. It's a very, very high risk for having an embolic. That means a blood clot gets formed in the heart when the patient has atrial fibrillation, and it can be dislodged to the brain or other organs, and it can have catastrophic results. Fortunately, the minute that we see a patient with atrial fibrillation, we have very good blood thinners with a low risk profile, and we now more and more and more and are doing interventions with devices to prevent the electrical abnormality, many, many times avoiding or skipping multiple drug trials that often don't work well, and they have many side effects for atrial fibrillation. So our field is moving very aggressively to terminate the atrial fibrillation with something we call catheter ablation. And I just want to remind everybody that is totally expected to have, it's the message I give my patients when they leave my office, that is expected to have normal longevity with this condition.
Thank you so much for sharing that information. Now let's talk a little bit about the state report card for Florida. I think we should have yep, here we go. So the HCMA has taken on a very large project to evaluate every state's preparedness for dealing with patients with hypertrophic cardiomyopathy, starting with HCM Awareness Day. Sadly, Florida does not have a resolution yet for HCM Awareness Day, and we're hoping that you will do that for next year. It's a little late for this year because it's today, but we've got a number of states around the country who have proclamations, resolutions, and even a couple of laws recognizing the fourth Wednesday of February as HCM Awareness Day. We also are looking to see that communities are safe and have preparedness ready for AED deployment, Good Samaritan coverage for those who provide life-saving care through CPR or AED deployment, and a lot of other elements of what we call the Healthy Cardiac Monitoring Act, which I'll talk about in just a few moments. So you can look at your state report card, you can see what your grade is, and you can see where you can improve. If we happen to have missed an element of our report card that you see that you do have some legislation covering and we've missed, please do inform us. So we'd love to challenge you to see if there's anything else we've missed, or anything else you think is important to be adding to your report card, so that we ensure that not only are we getting to diagnosis, but we are removing barriers to access care for patients throughout the state. So why is this important? I'm going to tell you a real life story of a young lady named Jillian Blair. This is not a happy story, but it is one that you can learn a great deal from, and you're going to hear directly from her mother in just a few moments. So let's hear from Amy Blair as to what happened to her daughter Jillian and how you can help assure that this does not play out again in the state of Florida. Just hit the key and it'll take to the next slide.
Thank you. Okay. So on February 15th, 2022, which is 2 years exactly today, my 17-year-old daughter, Jillian, and we walked into our family physician's office for her well child check. And while we were there, the doctor put her stethoscope onto Jill's chest, and she turned to me and she said, "When did Jill get this heart murmur?" And so that appointment led to us going to see a pediatric cardiologist in Des Moines. And from there, we had the diagnosis of hypertrophic cardiomyopathy. And those were severe and obstructed. They were still lingering in the air when we were waking up in Omaha, Nebraska to see specialists 1 week later. She went ahead and did a battering of tests. And then on Thursday, April 21st, 2022, the doctors were able to come back and give us our very last test result, which was her genetic test that she was positive for the MYBPC3 gene, which connects her to HCM. She came home from school that day. We went ahead and made an arrangement to see them on Monday and kind of get a plan of action. She came home an hour and a half later after I hung up the phone with the doctor, and I told her what they discovered. And she said, "Okay, that's about what I expected." She ran up the stairs where she had a sudden cardiac arrest. I was able to get up to the stairs within a minute or two. There was a lady who lived across the street who actually sold AEDs, so I had an AED on her within 2 minutes. But unfortunately, our efforts, the efforts of the EMS and the hospital staff were not successful, and we lost Jillian that day. So Jill was a very funny and outgoing girl. She loved music. She loved Harry Styles. He was her favorite. She loved art. She was really, really bad in algebra, and she wanted to be a designer one day. After Jill's death, it was like an explosion went off, and I started connecting dots within my family. And I talked to lots of families on my members of my paternal side, and I found out that we had a lot of similar heart problems. With the help of Omaha, we were able to get all of my siblings, all of my cousins tested. And when we discovered that I had HCM, half my siblings had HCM, 25% of my cousins had HCM. And from then, we now have many of us have ICDs and have had myectomies. We have also lost them. My brother has died in a surgery that was a valve surgery for an enlarged heart. My nephew has had 2 myectomies. My sister had a sudden cardiac arrest 5 months after my daughter died. And I just say that she died of a broken heart, since we're not ever sure exactly what it was. But my family is actually lucky because of Jillian, because she was our call to action. Because of her, my family has the power of knowledge to be able to fight against an invisible gene. But not all families are that lucky. But there is hope for them. Had there been big questions that were in place when I took all of my girls to their well-child checks that we were asked each time, so that in 2010, when my nephew had his first myectomy, or in 2015, when my brother had died on the surgical table from his HCM, maybe some of the doctors could have put it together that we needed to do a little bit more investigation. Or when my 91-year-old father, who had HCM, and that's how he went down to, he had a sudden cardiac arrest. But if he had gone into his Medicare first visit and was able to tell them that he had 7 siblings who died, all of cardiac arrests, maybe that would have been a trigger to have them look at us a little bit easier. If we had gotten the treatment earlier, I'm hoping, it would have been hopeful that she could have got diagnosed earlier, which would have led to earlier treatment, and maybe would have saved Jill's life. And lastly, I am a nurse in Iowa, and I work at a family practice clinic. It would take me 5 extra seconds of my day to ask these questions to a patient, and that would help save thousands of dollars, millions of dollars, and keep thousands of family intact and whole. I wish it wasn't me standing here, and I wish it wasn't my daughter. I wish it wasn't my family. And I wish it wasn't that I know the heartbreak that people go through. I wake up every day and I live a nightmare. But it is me, and it is my family, and it's my wish and my hope. And I wouldn't be standing here, and none of you would be hearing my voice if it wasn't for the life of a girl named Jillian Blair, and she had HCM.
That story is devastating. And if it doesn't make you a little nervous, check your pulse. This can happen to any family. There can be things hidden. So how do we put the pieces of the puzzle together in such a way that we could have gotten there in time for Jillian and her family? It's too late for them, but it's not too late for thousands or millions of families around the United States and around the world living with genetic heart disease. If we could have cleared this up earlier through something called the Healthy Cardiac Monitoring Act, maybe Jillian would be alive, and hopefully we'll be able to save families from knowing this individual heartache. So Jillian was a bright, sparkling, very unique individual. I love her makeup style. She loved David Bowie. She has lots of great fashion sense, but the world is never going to be able to see what she was capable of creating for us because Jillian's gone. There's another young man I want to tell you about, and his name is Derek Armstead. Derek's story is similar, but different, because Derek was 29 years old when he passed away in August of 2020. But what happened ahead of that? Well, what do we know? Derek's mom passed away before she was 30 from some kind of heart problem. They weren't really sure what it was because Derek was a small child when his mother passed away, and his sister was still just a couple years older than him. And they didn't really understand what was going on because they were too young, and time goes by and we stop looking at the details of our family heart health history. So one day in August of 2020, Derek was playing with his nieces and nephews, and he passes out. And the ambulance is called. He's brought to the emergency room, and he is a strong African-American man, 29 years of age, looks healthy from the outside, and he's just passed out. So the emergency room tells him, "We think you had a seizure," but they never checked his heart, and they never asked him about his family heart health history. He goes home. 5 days later, he is bringing his young son back home so he can run out and grab some dinner. He brings him up the stairs, carrying him in his car seat, gets to the top of the stairs, and in front of his fiance, he collapses for the second time in 5 days. Unfortunately, this time he did not spontaneously get his heart rhythm back, and he passed away that day. And this little man, his son, will never know his father. This should not have happened. He should have been identified as a young man with heart disease. This occurred in Virginia. So it's not Iowa that's a problem. It's not Virginia that's a problem. It's our healthcare systems not looking for genetic heart disease. So we have to come up with ways to help them do that. One of the things that we're doing at the HCMA is called the All Hearts Collaborative. We believe that health equity is critically important, and we want to make sure that all people with genetic heart disease are identified, no matter of their ethnicity, age, or their geographic location. So we're hoping to share more with you on the All Hearts Collaborative as the year progresses. But what can you do? What can you do as state legislative body to help identify families at risk of heart disease in the young? In your well child examination, we can ask some simple questions. We're not asking for a particular test. And in fact, we're not asking for any money associated with this, other than maybe a small amount for training of our physicians. In the state of New Jersey, we enacted this law in 2015. I'll admit I wanted to get to you guys a little bit sooner and get this initiative rolling, but yours truly got a little sick for a while and had to go get a heart transplant and get better and come back. And now I can talk to you about all of this. So we need to have your state legislative body help us by asking that every well child examination in the state of Florida includes questions on family heart health history, and that your student athlete pre-participation physicals are handled in the same manner as the well child exam. Because as Dr. Hasday very clearly stated, this is not just an athlete's problem, it's a people problem. Everybody has a heart and everybody has a chance of having a genetic heart muscle disorder. So if we just ask the right questions and look for family histories or symptoms that are consistent with genetic heart disease, including presence of a murmur, shortness of breath with exercise, family history of sudden death, heart failure, atrial fibrillation, pacemakers, all of these keys can lead to who should be referred to the doctor and for what. That is what we're hoping you will help us with on the state level, as well as recognizing HCM Awareness Day in the future. We're also looking at federal initiatives, which we took. I don't know where my federal slide went, but we'll get there in a minute. So the federal initiatives, we were at Capitol Hill. That's where you saw the Amy Blair footage from 2 weeks ago, where we were asking our federal partners to add the same heart health history questions to the Welcome to Medicare visit. So we get the children, we get the grandparents, and then we get the parents in between. And if you join us this evening, you'll hear a story of a family from New Jersey who was identified in exactly this fashion. It worked. We're able to get to the family and get them care that they need and hopefully keep that family whole. So let's look at the statistics for the state of Florida. You are a very populated state. You have 21 million people in the state, and there's about 4 million children in the state of Florida under 18 that could benefit from the Healthy Cardiac Monitoring Act. What do we expect to see in the state of Florida? On the low end, there are about 237,000 individuals with identifiable genetic heart disease, and as high as nearly 700,000 in Florida alone. We need to find these families. We need your help at the state legislative level to identify these families, not to spend more dollars in healthcare, but to use healthcare dollars more effectively and make sure that those who are in need of care have access to it. So this is my Capitol Hill photo that I was going to show you a second ago. If you'd like to join us this evening for our webinar, you will hear the story of Jared Butler, who is currently playing for the NBA team, the Wizards, and he has a diagnosis of hypertrophic cardiomyopathy. So you can come hear him talk tonight, and you can hear all about these wonderful initiatives and all of the work that we're doing to try to find families worldwide. We have, thankfully, many legislative partners with HCM Awareness Day. Oh, we do have Florida for 2024. How did I miss that? Florida, I'm sorry. We didn't update your report card yet. Ross, get on that. Somehow I missed that. We've been a little bit busy, so sorry. We have many proclamations, even from local towns. And these two individuals here in this photo are sisters who 7 years apart had heart transplants. And the one on the right just got her heart transplant this month and was already out at an event trying to raise awareness about HCM. So thanks to them. And if you'd like to set up an appointment to discuss how you and your office can help raise awareness and help move legislation that will identify families at risk for genetic heart disease. By all means, use this QR code and set up an appointment or email us at support@4hcm.org, and we will be more than happy to assist you. We do have one of our state legislative champions who is in the state of Florida. His name is Scott Baracus, and he can help you with things on the ground, and we can get you guys in touch with Scott, who does actually work at the State House as well and has a lot of experience in this space and is one of our very big-hearted friends. Thank you to our board, contractors, staff, volunteers, and partners, especially our partners at Dr. Hasday's HCM program located in Orlando, and we will be happy to take any questions from you at this time. And if there's anything we can do to assist you in understanding HCM or our initiatives anymore, please do not hesitate to ask us. Dr. Hasday, how are we doing?
Oh, good. That was an excellent presentation.
Fantastic. Awareness Day for Florida is being heard today. Let's get it done. I didn't know that. This is late breaking news, people. This is what happens when you're up to one of the biggest days of your year and you've been at home for a week with COVID, and this is your first day back to the office. So my apologies for missing the updates on Florida on that one. I don't see any questions at this point. I will bring us back up to this screen. So Dr. Hasday, you've been, gosh, how long have we known each other? 15 years now?
Almost. I met you in 2010.
Yeah, damn close to 15 years.
Was it 2009? I think it was December 2000, no, October or November, the summit in Minnesota in 2009. I met you.
So it's been 15 years.
Yeah.
And your practice has grown exponentially. And how many patients are you taking care of now in the state of Florida with HCM?
Well, I used to say 450 family, but I'm seeing so many weekly. I'm not even, I am doing it, actually, I'm doing a project that I will have the exact number because after the last meeting that you invited me to, in Morristown, I became aware from listening to many of the speakers, the sometimes lack of minority representations on trials.
Yeah.
And I wanted to see if Orlando is different, either because perhaps there's more access to healthcare, whatever the reason. I want to know and not give us a pat in the back, but give us a grade. So I assigned one of my medical residents who is always eager to do projects and to look at the demographics of our patients and then break it down and tell me who of those patients had defibrillators, who had genetic testing, who had myectomy, who has been treated for heart failure. So I just want to make sure that we have a level playing field, and that's he's helping me to get that data. And it's almost compiled. He actually is going to present a case from my clinic at the ACC meeting in April.
April in Atlanta. Fantastic. Yeah. We definitely need to do more work on health equity in HCM. There is a disproportionate number of Caucasians who are identified right now, and we need to find those members of the Black and Brown community and identify them as well. So if you are Latino, if you are Black, if you are Asian, if you are Native American, you have a 1 in 250 chance of having HCM as well. So please make sure that you are talking about your family heart health history and that we are doing everything possible to identify those at risk before it is too late. So we're going to wrap up today. If you have any other questions, please let us know. If you're watching this live, that is fantastic. And we see your questions. Steve, we're not going to be discussing HCM management today. We're focusing on legislative initiatives. If you want to hear about CAMZIOs and other clinical trials in HCM, please join us this evening at 6:30 p.m. Eastern Time for HCM Awareness Day with the HCMA. And we're going to be going over a lot of different topics, including medical management, legislative initiatives, our ambassador program, and much, much more. So thank you all for taking some time to join us today for this legislative briefing. And we wish you a happy HCM Awareness Day and a healthy heart month. Thank you very much.
Thank you. Thank you, everybody. Thank you, Lisa.
Thank you.
Bye-bye.